Hello. Today I want to talk a little bit about what is functional medicine. Now, the functional medicine tree is about getting to the root cause of your fatigue, weight gain, gut issues, hair loss, and more. Now, before I explain how the functional medicine tree works, I want to explain how it's different than the conventional medicine that we know nowadays. The way medicine works nowadays is a patient is diagnosed with a disease and or symptoms, and then the appropriate medication is prescribed for them. I think of that as the leaves. So if you look at this tree, it might be a little bit small to read, but I'm going to explain to you each one of those big leaves has an organ system. So there's gastroenterology, endocrinology, cardiology, pulmonary, urology, and hepatology. And patients have different diagnoses and different symptoms, and then they see the different specialists and are usually prescribed medication for the symptoms. How is functional medicine different? So with functional medicine, we start here at the roots. So down at the bottom, I'm actually pointing with my arrow there, we see 5 different roots. Those include sleep and relaxation, exercise and movement, nutrition, stress, relationships. And right above that, notice right in the center, it says genetic predisposition. And on either side, it mentions different things. So it mentions mental, emotional, spiritual influences, and then experiences, attitudes, and beliefs. And then we go up, it mentions triggers. And that's the foundation of health. And in functional medicine, we treat at the roots. So we work on these 5 different nodes. We work on the nutrition, which is a very big part of it. We work on how is your sleep. We work on managing stress, all of those things. And hoping that the leaves that then are sprouted are healthier. There's not all of these signs and symptoms because we've been working at the root. Now, where do we start? A good place to start is the medical symptoms questionnaire. This goes through a series of questions on the different organ systems and symptoms that you might be having, and it gives you a score. You look at the end, what is my score? Optimal is less than 20. Mild dysfunction is between 21 and 50, moderate is between 51 and 100, and severe is above 101. So you rate each question here. For example, under head, it says headaches, faintness, dizziness, insomnia, and you rate it from 0 to 4. 4 meaning that you frequently have this effect. So the higher score at the end means that you're having more symptoms. And what does this tell you? If you're optimal, it means you're probably feeling pretty good. You probably don't even feel like you need to go see your doctor very often. If you are at the other extreme of severe dysfunction, your life may include doctor's appointments weekly. And if you're somewhere in the middle, you probably wish you felt a little better, and maybe you have some troublesome symptoms going on, and you're not quite sure what it's going to take to feel better. Especially if you go and see your doctor and your lab work comes back pretty good, but you're like, I just don't feel 100%. I don't feel as good as I used to. A good question that we like to ask in functional medicine is, when was the last time that you felt well? And we go back there, we look at what was going on then, what potentially could have led to your symptoms increasing. And so after filling out this questionnaire, then you can make the decision to schedule a foundational functional assessment. And again, how is this different than a regular doctor's appointment? Now, in I'm a physician, I'm a board certified endocrinologist, and I love my job and I love that I can help people in a clinic. And however, the way the medical model is set up, the appointments are not set up to look at all of the root causes, because this is something that takes more time when we go into detail, looking at from birth till now. How has your health been? What are the different events that you've had in your life? We look at, even for example, were you on antibiotics frequently as a child? Because that can affect your microbiome, and that could be the root cause of some of the other issues that you're having, even weight gain. So after you fill out the MSQ and get some blood work done, then you fill out a very detailed history. It's about 17 pages. And then this information, I look over it and I place it in this kind of chart, and I look at all of the different things that you have marked. So we can see, well, it looks like you're doing okay with exercise and movement, but your stress is not being managed as well as it could be. And so this is a very useful chart to look at and see what are the areas that need attention first. And after the initial appointment, then you can decide where you'd like to go from there. And this little chart explains the journey. And one thing that I would like to say, again, with functional medicine, my goal is not that you are a patient for the rest of your life. My goal is that you spend some time working on the different areas, the different nodes in the tree, like I showed you, however long that takes for you to get to a point where you feel like, now I feel well. And not only do I feel well, I know what it takes for my body to feel well. So even if I happen to stray from that, let's say I've been eating pretty well, and now it's summertime and we had some family events. So I know that I haven't been eating like I usually eat, and I'm not feeling as well as I usually do, but I know exactly what I need to do to get back to where I want to be. So after filling out the MSQ, then you schedule a foundational functional assessment after filling out the appropriate paperwork. And from there, we go over and see which areas it makes most sense to start with. And from there, I have a few different pathways. One of them is a 60-day detox and gut repair program, which has been very useful for many patients, including myself. And another one, another option is, if appropriate, perhaps you need to do a GI test and go through a different kind of program. Or some people who are going to have their own custom-made program from the get-go can join a monthly membership, and then I might recommend different testing and a different program. Now, everybody eventually can end up in the membership. Now, some people might feel fantastic and feel like it's enough to do the 60-day program, but usually it takes a little bit longer to get to where they really want to be. And that's why there's a membership available where it's different, there's different levels of how many appointments you would have in a year. The testing is personalized to you, as is the follow-up and the recommendations. Now, you would go through that membership as long as it takes for you to feel well, where you want to be, and then you graduate. Now, this could be different for every person. Some people might take 6 months, some people might need about a year. A good rule of thumb is, if however many years you've been sick, usually it might take about 1 month for every year. It's just a formula that many different functional physicians have found is the norm for patients. And it also highlights the fact that it took a while for us to get unwell, and it might take a little while to get well. It doesn't happen overnight. That's the other thing with functional medicine. It's not all about a quick fix, just taking a pill and feeling better. It's really learning about one's body, going deep to see what is going on inside my body and what can I do to help it heal and get better.